After prolonged high-fiber intake, gut bacterial populations can shift so dramatically that they create small intestinal bacterial overgrowth, SIBO, or other forms of dysbiosis. The irony is thick. Your healthy, high-fiber diet contributed to intestinal bacterial imbalance, causing severe symptoms. The microbiome disruption follows understandable patterns. Certain bacterial species thrive on excess fiber and overgrow. Other beneficial species decline from the imbalanced environment. The resulting bacterial population causes more problems than your original diet. Your gut bacteria essentially unionize against the working conditions you've created. SIBO symptoms overlap with many conditions, causing diagnostic confusion. Severe bloating, especially after eating, becomes constant. Abdominal pain and distension make you look pregnant. Diarrhea or constipation alternate unpredictably. The irony that healthy high-fiber eating contributed to bacterial overgrowth is frustrating when you discover it. Diagnosis confusion is common because symptoms overlap with IBS, food intolerances, and other gastrointestinal conditions. Expensive testing becomes necessary: breath tests measuring hydrogen and methane, comprehensive stool analysis. Eventually, you discover that fiber was feeding problematic bacteria, creating overgrowth in your small intestine where bacteria shouldn't be numerous. The treatment paradox is striking. SIBO treatment often requires low FODMAP diets that restrict many fiber sources you'd been eating abundantly. Sometimes antibiotics are necessary to reduce bacterial overgrowth. You slowly reintroduce fiber after treatment, the complete opposite of fibermaxxing. The approach that supposedly optimized gut health actually disrupted it severely. Prevention strategy is straightforward in hindsight. Moderate fiber intake prevents this issue for most people. Diversity of fiber types matters more than massive amounts of single types. Recognizing when digestive symptoms worsen rather than improve with fiber allows course correction before developing SIBO. Supplement roles in triggering SIBO deserve attention. Prebiotics and fiber supplements sometimes trigger bacterial overgrowth in susceptible individuals. Manufacturers don't warn about this risk adequately. The irony of gut health products causing bacterial overgrowth would be funny if it weren't causing genuine suffering. Recovery timeline is discouraging. Treating SIBO takes months of careful dietary management and sometimes multiple antibiotic courses. You must carefully manage fiber intake during and after treatment. Some people never tolerate high fiber again after SIBO. Their gut bacteria remain sensitive to overfeeding even after successful treatment. Why does this happen to some people and not others? Individual susceptibility varies based on genetics and gut anatomy. Slower gut motility or structural issues predispose some people to SIBO. The combination of susceptibility factors and aggressive fibermaxxing creates perfect conditions for bacterial overgrowth that wouldn't have developed with moderate intake. The lesson is clear: more isn't always better. Your gut bacteria need appropriate amounts of fiber, not maximal amounts. Overwhelming your microbiome with fiber can backfire severely for susceptible individuals. Moderation prevents bacterial overgrowth while still providing fiber's genuine benefits.